Hello guys, so now we shall be discussing different types of cranial fossa. Okay, so we have got three different types of cranial fossa. One is called as the anterior cranial fossa, next you called as a middle cranial fossa, and the third one is called as a posterior cranial fossa. So out of all these three important cranial fossa, right, first of all let us look at all these cranial fossa and then we shall discuss in detail, right. So for example, from the side view, okay, from the side view, if you look at the picture, this is how the cranial fossas look. For example, let us say, right. So here, if you see, this is the lateral side of this face, right. So in this lateral side of the face over here, see the cranial fossa which you have over here is called as the anterior cranial fossa. The cranial fossa which you have over here is called as a middle cranial fossa, and the cranial fossa which you have over here, which has got a very big opening, called as posterior cranial fossa. So this is the skull vault. Okay. Now within this skull vault is what you have your, what is this? This is your brain, right? So this part which I have drawn is your cerebral hemispheres, right? This part is your cerebral hemispheres, and after that the next part which you have got is the midbrain. After the midbrain you have got pons, and after the pons you have got the medulla oblongata, and then spinal cord which is hanging down like this. Okay, so these are the different parts. Now important thing we need to know is that first we shall be mainly discussing, okay, first we shall be mainly discussing about this anterior cranial fossa. After the discussion of anterior cranial fossa, then we shall discuss about the middle cranial fossa, and after that at last we shall discuss about our posterior cranial fossa. Okay, now in this anterior cranial fossa, this is from the side view. Okay, this is from the side view. Now if you are looking, for example, let us say that you are making a section like this. Okay, you are making a section, and if you are directly visualizing from the top, right, how does these three cranial fossas look? This is how the cranial fossas look if you are looking from the top. So which means this is the nose, right? So these are the ears, and let us say this is the hair that is present on the back. So this will be your anterior side, this is your anterior side, okay, and this one is your posterior side, and these two are, one is called as the right lateral side and left lateral side. Now here also you can see three important cranial fossas, right? So see here now, see this cranial fossa which you can see like this is anterior cranial fossa, and this cranial fossa which you can see here, this part of the cranial fossa which you can see is called as a middle cranial fossa, and after that this particular cranial fossa which you can see over here is called as a posterior cranial fossa. So how many cranial fossas we have got? We have got anterior, we have got middle, we have got posterior. Now look at this picture, it will be much more clear. So this entire part is called as your anterior cranial fossa, and this part over here is called as your middle cranial fossa, and this part over here is called as your posterior cranial fossa. So there are three important cranial fossas over here. Now first what we shall be discussing is, we shall mainly focus on the anterior cranial fossa. Now before we focus on anterior cranial fossa, first of all let me draw the border. You see this border, whatever I have drawn, this is the border of your anterior cranial fossa. This is the border of your anterior cranial fossa. Okay. Now in this anterior cranial fossa, let us see what are the different borders over here. Basically in this anterior cranial fossa we have got three borders. Okay. So what are these three borders? Just have a look over here. What are these three borders, guys? First important thing, see this is the anterior border and this is the lateral border. Now tell me, is the anterior border and lateral border separate? It is not separate, right? Anterior border and lateral border is together. For example, I am telling you like this. If for example, if I am drawing a box like this, okay. Now I am telling you that this line over here, this line which you can see is present in the front. So this is anterior border. So this anterior border starts at this end and it ends at this end. Okay. So Next, where is the posterior border? This is the posterior border. Posterior border also starts at this end, ends at this end. And where is the lateral border? See, these two are the lateral borders, lateral and lateral. Now tell me, is the anterior and lateral continuous with each other? No. Anterior will start here and it will end here. The place where, the point where the anterior border is ending, from there again the lateral border will start. But in a picture like this, right, in a picture like this which is completely curved, which is in this way, right, so this part over here will be called as anterior, and you can also say that the lateral border is also in continuous with that. Okay, so this is what something I just wanted to share with all of you. Now if you look at this, what is a border here? I have got anterior as well as lateral border. See, this border is the anterior border, and this border over here is called as your lateral border. So just write it down. So this one, this particular part over here is anterior and laterally. Anteriorly and laterally. So anteriorly and laterally, what do we have? Anteriorly and laterally, I have got the inner surface, right, or the internal surface of frontal bone. Yes or no? See, this is all. See, this entire bone here, this entire bone till here is called as a frontal bone. Okay. Now, anteriorly and laterally, anteriorly in the front and laterally, completely I have got frontal bone only, right? So, which surface of the frontal bone? See, for example, if I am telling you like this, that see, this is the outer surface of the frontal bone with which I have drawn with the blue, right? And this pink one is called as the inner surface of the frontal bone, right? So obviously, which surface of the frontal bone? It is the inner surface of the frontal bone. So anteriorly and laterally, what do I have? I have got inner anteriorly and laterally I have got inner surface of next. Posteriorly, you have got two important things. See, what are those two important things? See, this line which I am drawing right now, you see, this entire line is a posterior border. Posteriorly, if I have to divide, I will divide into two ways. One is, see, this part is lying in the midline, so this is called medial, and these two are wing-like structures that are lying on the lateral side, so these two are lateral. So posteriorly, I have got two important things. One is called as posteromedially, another one is called as posterolaterally. Okay. So posteromedially, what do I have? See here. This is posteromedially, right? So this one over here is your posteromedially or posteriorly and medially. Posteriorly and medially. So posteriorly and medially, what do I have got? I have got this particular thing, you see, this particular thing which I am highlighting it right now. This particular thing is called as the limbus of sphenoid bone. Okay, what is this called? This is called limbus of sphenoid bone. Limbus of sphenoid bone. Okay, this is called as limbus of sphenoid bone. Next, after posteriorly and medially the limbus of sphenoid bone, what is this particular structure over here? What is this? See, this one on one side, right? You see this one on one side and this on the other side. What are these two structures over here? This is posteriorly and laterally. Posteriorly and laterally. So posteriorly and laterally, what do I have got? I have got the lesser wings of sphenoid. What do I have got? I have got the lesser wings of sphenoid. They are called as the lesser wings of sphenoid bone. Lesser wings of sphenoid bone. Okay. So if you look at this particular skull representation over here, the skull cap is removed. Now in this, you know, this is the frontal side. Okay, and this is the back occipital side. Now all of you just look at the picture. This is the frontal, this is the occipital side. Now here, this particular cranial fossa which you can see is called as your anterior cranial fossa. So this is your anterior cranial fossa. This is your middle cranial fossa and this is posterior cranial fossa. So in this picture, what did I show you? Posterior cranial fossa is having an opening. You see the opening here? This opening is the largest opening in the skull. This is called as foramen magnum. This is the place from which the spinal cord will pass down. Okay, so this is the brain over here. The spinal cord is passing down like this. So this is anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Now in this anterior cranial fossa, what are the borders? See, if you can look here very clearly, that this is the anterior border and this is the lateral border. So anterior and laterally, what do I have got? I have got the inner surface of the frontal bone. Next, posteriorly, when you see, posteriorly there are two things. See, this center one is posteromedially and these outer ones are posterolaterally. Okay, center is posteromedially and you see the wings here. There are two wings, right? So these two wings are located laterally. So posteromedially, what do you have got? You have got this particular structure over here. This particular structure over here, this is called as a limbus of sphenoid bone. Next, posterolaterally, what do you have got? You have got wings of sphenoid bone. Which wings? These are called as lesser wings. Then where are the greater wings? See, this part is called as a greater wing. Okay, you see this? This is called as a greater wing of sphenoid and these two wings over here are called as the lesser wings of sphenoid. Okay, so we have got the lesser wings of sphenoid posterolaterally and posteromedially we have got the limbus of your sphenoid bone. Okay, so this is one of the important thing which you have to know. So this is what I was telling you here, that anterolaterally I have got what? Anterolaterally I have got the inner surface of the frontal bone, right? Next, posteromedially I have got the limbus of the sphenoid bone. Posterolaterally I have got the lesser wings of sphenoid. So this is what you need to know. Okay. Now, once after knowing the borders, so far whatever we have discussed is called as the borders. So far whatever we have discussed are the borders here. Okay, borders of what? Borders of your anterior cranial fossa. Now after the borders, look at this picture over here. You see these black dotted lines that are located on this yellow color bone. In front of that, whatever is in blue, that is what is called as your what? That is what is called as your anterior cranial fossa. So this part over here. So this is your anterior cranial fossa. Okay. After this within this anterior cranial fossa, what are the different kinds of bones which you can see? So this part of the bone which you can see over here is called, which is in blue, is called as a frontal bone. Okay. So this part of the bone is called as a frontal bone. So basically right now I am discussing what are the different kinds of skull bones which you have in the anterior cranial fossa. Majority of the skull bone which you have is called as a frontal bone. After that, you have just a border here, you see, just a border of which bone? This yellow color bone, that is called as your sphenoid bone. Okay, you just have got a border of the sphenoid bone. And after that, this center bone which you can see over here, right? So this is what is called as your ethmoid bone. Ethmoid bone. Okay, so in the lateral aspect, how you can see, this is your frontal bone again, right? This yellow color one over here which you can compare with this picture over here is called as your sphenoid bone, and this part of the bone which you can see here, this is called as your ethmoid bone. This is called as your ethmoid bone. So if someone is asking you what are the bones that comprise of the frontal anterior cranial fossa, you have to tell there are three bones. One is called as frontal bone, ethmoid bone, as well as the sphenoid bone. Okay, right. Next important thing you have to concentrate over here is that if you look at the skull, okay, so if you look at the skull, right, so this bone which you have in the center, right, so this bone is what is called as your sphenoid bone. This is called as your ethmoid bone. Just in front of the ethmoid bone, you see this ridge right here very clearly. You can look at the ridge. Now this particular ridge which you can, this bony ridge whatever you can see, this is present exactly in the frontal region. So that is why you call this bony ridge as frontal ridge. Okay, so what is this bony ridge called as? This is called as frontal ridge or frontal crest. Okay, so what is attached to this frontal crest? Flax cerebri is attached to this frontal crest. Now what is flax cerebri? So before I tell you that, you just remember that in the complete front region you got a ridge, a longitudinal ridge here. This ridge is nothing but called as your frontal ridge or frontal crest. Right, to this crest or ridge flax cerebri is attached. Now where is that ridge over here? I think you cannot see at the ridge in this picture, but very clearly you can visualize over here. Okay, so let me put up this picture over here once again, so that you will understand where exactly this ridge is located. Okay, so if you look at this particular picture over here, now well, if I'm zooming it out, if I'm zooming it in, if you can see over here, you see this particular ridge in the center, right? So this particular ridge again, right, you can see a particular ridge in the center like this, right? So this ridge again, once again, see in the frontal, complete frontal region, you see a ridge like this, right? So this ridge is what is called as frontal crest. Okay, so this particular ridge over here is what is called as your frontal crest. See, exactly you can look at the frontal crest here. I know it is not that clear. See, this part over here is called as your frontal crest. What is this frontal crest? Frontal crest is nothing but your bony ridge. Frontal crest is nothing but your bony ridge. And to this frontal crest, what is attached? I told you the flax cerebri. This is the site for the attachment of flax cerebri. What is flax cerebri? Flax cerebri is attached. First of all, what is flax cerebri? What is flax cerebri in the sense? If you have to understand what is flax cerebri, what we will do is that you know very well that here you have got right cerebral hemisphere. This is called as left cerebral hemisphere, right? So these two are the cerebral hemispheres. Now what I am telling you is that I will make a coronal section like this, and then I will remove this part, and from the front if you see, you will understand what is flax cerebri. For example, in the coronal section, let us say, again just a rough picture, okay? So let us say this is your coronal section of your brain. Okay, so this particular part over here is your coronal section of your brain like this. So this is your coronal section. Now what I am trying to tell you is that surrounding the brain, you have got meninges. What are the three different types of meninges you have got? We discussed in neuroanatomy. There are three types: outer dura mater, and next middle we have got arachnoid matter, and inner we have got pia mater. So what I am trying to draw here is that I am drawing just the dura mater. You see the dural matter which I am drawing here, and this dura matter will fold inward like this. Okay, will fold inward, and then the dura matter is completely applied to the entire surface in this way. Okay, so this is the dura matter that is completely covering in this way. Clear all of you? Right? So this fold of dura matter which is coming inside, actually I will show you the real specimen also. This fold of dura matter which is coming inside and separating both the cerebral hemispheres, this fold of dura matter which is separating both the cerebral hemispheres, this is what is called as flax cerebri. So what is your flax cerebri? Flax cerebri is nothing but the fold of dura matter that separates the right as well as the left hemisphere. Left cerebral hemispheres. Okay, so if you look at another picture, you see this green color curtain like thing which is in the center, right? So here I have got my right cerebral hemisphere, on the opposite side I have got left cerebral hemisphere. Now this is a picture from the back. Now from the back, if you can very clearly visualize, that is very well and good. You see this covering here, right? Again I am removing it, just look at it. You see this fold, a very thick fold of covering like this. You see here also this continuous thick fold covering which you can concentrate over here, right? So this thick fold covering, once it comes onto the top, look what is happening. This thick fold of the covering is taking a turn inside like this. Okay, it is taking a turn inside, and till the entire cerebral hemispheres, you see how it is dividing? It is dividing the right cerebral hemisphere from the left cerebral hemisphere. So, this division of right and left cerebral hemisphere with the help of this fold of dura mater is nothing but called as flax cerebri. So, I will just put an arrows over here. You see this particular one over here is your flax cerebri. This is coming all the way like this. You see, this is what is called as your flax cerebri. Okay, so this is your flax cerebri, which is dividing the right cerebral hemisphere from the left cerebral hemisphere. Now, he is telling here that where this flax cerebri is attached, if you can see here, flax cerebri is attached to the tip, right? So, that tip is nothing but called as your what? That tip is nothing but called as your bony ridge, which is also called as your frontal crest. Okay, now you understood what is the use of this frontal crest and all, right? Right. Next important thing you need to know over here is that if I zoom into this picture, right, I just now told you that this part is called as your ethmoid bone, right? In the center of the ethmoid bone, you see a line. You see a line here in the center of the ethmoid bone, right? So, can I call this line as the midline of ethmoid bone? This midline of ethmoid bone is called as Crista galli. Okay, this midline of ethmoid bone is called as Crista galli. First of all, let me just put some arrows over here. Let me put some dots over here. See, this part is called as your ethmoid bone. This part is called as your ethmoid bone, out of which this center part which you can see over here is what is called as Crista galli. What is Crista galli? Crista galli is nothing but the midline of ethmoid bone. Crista galli is nothing but the midline of ethmoid bone. Where is it located? Exactly in the center. Okay. Now, what is the use of this Crista galli? Even to Crista galli also, your flax cerebri attaches. So, your flax cerebri here is attaching to two structures. One is called as Crista galli, and the other structure where it is attaching over here is called as your frontal crest. So, to your frontal crest and Crista galli, where is frontal crest? See, this is your frontal crest, right? See, this part is your frontal crest, and just beneath the frontal crest you have got Crista galli. So, to these two parts, your flax cerebri is attached. Flax cerebri is attached over here. Okay, right. Next important thing over here is that on either sides of Crista galli, again I am zooming in, you see on either sides of Crista galli there are multiple holes, right? So, these multiple holes which are located on either side of the Crista galli are called as foramen, right? So, first of all, what is this entire thing? See, what is this entire thing which is containing multiple holes on either side of Crista galli? So, these two entire things which are located on either side of the midline is called as cribriform plate. Okay. So, what is the name of this plate here? The name of the plate is cribriform plate. So, this plate over here is called as cribriform plate. Cribriform plate. Now, in this cribriform plate, if you see, you have got multiple foramina. Okay. So, these foramina which you can see over here are scattered here and there, right? But actually, there are these foramina divided into two types. So, one group of foramina are tiny multiple foramina, and next there are two large foramina also. Okay. So, if you look at this picture over here again, let me rub this out, then it will be clear for you. If you look at this picture, can you see multiple small foramina, right? Along with this multiple small foramina, can you also see one foramina is large here on the right side as well as on the left side, right? And here also down there is one more foramina which is large, which is not shown in this picture actually, but one foramina, the way it is large on the top is the same way it is large on the bottom also. Okay, so one is called as anterior ethmoidal foramina and the lower one is called as posterior ethmoidal foramina. Then what are these small foramens over here? These small foramens over here are called as multiple small foramina. Okay. So what I'm trying to tell you is that, so the important thing you need to know is that, for example, if this entire part is your, let us say this part which I'm drawing is your ethmoid bone. In the center of the ethmoid bone, you have got this particular line. So what is this line which is located exactly in the center? This is called as Crista galli. On either sides of the Crista galli, you have got multiple small foramina like this. You see small multiple foramina that are located on either sides of your Crista galli. So these multiple small foramina which are located on either sides of Crista galli is what is called as your cribriform plate. Okay. So on both the sides of Crista galli you have got cribriform plate. Now talking about this foramina only, these foramina which I have drawn on the cribriform plate, these are very tiny and small. So second group of foramina, one is large in the front and the other is large on the back. So if I have to write these things down, see here, foramina are divided into two groups. Okay, one is called as multiple small foramina. For example, you see all these are your multiple small foramina. After this multiple small foramina, next you have got another group of foramina. See here, this one is called as your anterior foramina, that is your anterior ethmoidal foramen, and this one over here is called as your posterior ethmoidal foramen. So what are the two types of foramens you have got? You have got one is called as the anterior ethmoidal foramen and the next group is called as your posterior ethmoidal foramen, on the right side as well as on the left side, right? So the same things which you have to write over here, anterior ethmoidal and posterior ethmoidal. Now the important thing is that if you look at these multiple foramina, okay, if you look at these multiple small foramina, so there are some important structures that pass through these holes. Okay, you see here, there are some important structures that are coming out of these holes like this. You see, small important structures that are coming out of these holes over here. You can see, right? So these structures which are coming out of these small foramina over here are nothing but called as olfactory nerve. Okay, so the structures which are coming out of multiple small foramina is your olfactory nerve. In the same way, the structures which should come out of anterior ethmoidal foramina, or anterior ethmoidal foramen, and structures which has to come out of posterior ethmoid foramen. So what are the structures? The structures which come out of anterior ethmoid foramen are nothing but called as anterior ethmoidal artery, anterior ethmoidal vein and anterior ethmoidal nerve. Okay, three things that are coming. One is called as anterior ethmoidal artery, anterior ethmoidal nerve, okay, and next anterior ethmoidal vein, okay, anterior ethmoidal vein. In the same way, from the posterior side, what are the things that are coming? One is called as your posterior ethmoidal artery, you have got posterior ethmoidal nerve, and you have got posterior ethmoidal vein. So these are the three structures that are coming from the back. Okay, so if you look at this picture, it will be completely clear, right? So here very clearly you can see this particular bone over here. Yeah, you see this particular bone here which I have highlighted again. Just look at this bone. So this bone over here is nothing but called as a cribriform plate, right? You cannot see the holes actually, but you can see numerous branches that are coming out of this cribriform plate. So these branches are nothing but called as what? These branches are nothing but called as your olfactory nerve. So this plate over here is called as your cribriform plate. cribriform plate, and through this cribriform plate you see these coming out. These are nothing but called as your olfactory nerves. Nothing but called as your olfactory nerve. Okay, so these are the two important things which you can see over here, right? So here also very clearly you can see that this center structure which I am drawing over here is nothing but called as your crista galli. On either side of the crista galli you can see openings like this. So these openings are multiple foramina, and here this opening over here you see on both the sides, this is called as anterior ethmoidal foramina, and on the posterior side also you cannot see the opening. If you can see, then that is well and good. You see there are two openings here, one on the right and one on the left. These are called as posterior ethmoidal foramen. Okay, so we have got anterior ethmoidal foramen, we have got posterior ethmoidal foramen, as well as multiple small foramens. Okay, now in this entire frontal bone, see from here all the way, what did I tell you? I told you that from here all the way like this, right? So this entire bone which you can see is the frontal bone, right? So out of this entire frontal bone, which part of the frontal bone is thinnest? The part of the frontal bone which is thinnest is your cribriform plate. You see, the cribriform plate is the thinnest part of the frontal bone. So if this is the thinnest part of the frontal bone, don't you think this cribriform plate is most commonly to be fractured, right? Now if this cribriform plate is fractured, what can happen? What can happen, you tell me? If this cribriform plate is fractured, through this cribriform plate what structures are coming out? You can very clearly see that the olfactory nerves are coming out, right? This is what I was telling you, that this center part, whatever you can see over here, this is called as your cribriform plate, right? So this is your, basically it is your ethmoid bone, right? In the center of the ethmoid bone you have this longitudinal ridge like thing. This is called as crista galli. On either side of crista galli you have got these two plates like this, where there are multiple foramens on the plates. These two plates are called as cribriform plates, right? Now important clinical point you need to know is that, see, this entire is your anterior cranial fossa, right? So this entire part like this is your anterior cranial fossa, right? Now important clinical point over here is that out of this entire anterior cranial fossa, out of all the parts of this entire anterior cranial fossa, right, you know that in this anterior cranial fossa there are three bones, right? So what is this bone here? See, this particular bone over here is called as your frontal bone, right? This is your frontal bone. And next, this particular bone which you can see over here, this is called as your sphenoid bone, right? And this is called as your ethmoid bone. So this one over here is called as your ethmoid bone. Now out of all these three bones, which is the most common bone to be fractured? To know that, first of all you have to know which part is the thinnest part, right? So this cribriform plate, whatever is there, that is the thinnest part, and this is the most common in the frontal, in the anterior cranial fossa to get fractured. Okay. So what is the most common fracture over here? Most common fracture of anterior cranial fossa. Most common fracture of your anterior cranial fossa, that is your cribriform plate. That is your what? That is your cribriform plate, right? Why cribriform plate is the most common to undergo fracture? Because this is the thinnest part. This is the thinnest part over here. For example, if this cribriform plate is damaged, what will happen? What did I tell you? Coming out of this cribriform plate, what do you have? You have got bundles and bundles of olfactory nerves, right? So what can happen? These olfactory nerves will be cut off, right? If olfactory nerves are cut, do you think patient can smell anything? He cannot smell any substance, right? So that is called as anosmia. So if this is fractured, what can happen to the patient? The first thing what can happen to the patient is that olfactory nerve damage can happen. Olfactory nerve damage can happen. If olfactory nerve is damaged, then patient will end up having anosmia. Second important, what is the second important that can happen is that, look here very carefully, that see, this is the part to be fractured, right? What is present here? There is right cerebral hemisphere, there is left cerebral hemisphere. Attached to the cerebral hemisphere, there are meninges. All of you know, outer dura, middle arachnoid, and inner pia mater. So along with the meninges, the brain is present in this way. If this part is fractured, then what will happen? This anterior part of the brain, right? So meninges are covered like this. This here the bone is fractured. If the bone is fractured here, the bone fragments will pierce the brain. Yes or no? But before it pierces the brain, what will happen? It will first pierce all the 3 layers here. If it will pierce these 3 layers, what will happen? The CSF will be leaked here, right? Where the CSF will be leaked? In the anterior cranial fossa, in the anterior most part.